Hi Karen, my name is Tabitha Musa, and I'm responding to your second discussion board post about medication assisted treatment, um, and how the evidence that exists for it, and based on its outcome, how it has impacted patients. In your write up, you did state about the fact that most of the evidence that have been used for medication assisted treatment as a solution for addiction has been a bit inconclusive and weak at best. I think McLean mentioned that in her write up, in her essay, in which she stated that it's not been as efficient as it's meant to be. You did also talk about the fact that and I agree with that point that psychotherapy needs to be incorporated for medication assisted treatment to be totally effective. One of the part of the research that has been taken or that has been written out has always talked about the different ways in which it has been incorporated and how most of the studies that have been used have been based on outpatient studies, not those within the hospitals. If you take that into cognizance, all those factors, I can understand where you're leaning towards the fact that there is not a one size fit all scenario for these treatments, and that different individuals, different addicts, different conditions, different brain diseases will have different outcomes. I also agree with you that might be beneficial for others and it might be harmful to others. But part of what my question is to you is, do the benefits outweigh the harm? Because while there've been research done and science is evolving, life is evolving, right? What more often than not, these medications have been used as a way of gradually tapering off the addicts or gradually detoxing them from the harmful effects of either process or substance addiction. The FDA had approved this medication, so there exists some evidence base to show that these drugs are a bit effective, and on the long term, they act as a stopgap to prevent or to help the addicts from having a relapse. So I did read through some of the write up, and I think Smith was very specific about where the advantages were on math. And I think part of what he stated was that it seemed the intervention itself, in collaboration with psychotherapy, and my emphasis on psychotherapy and other behavioral interventions, with these interventions combined with the medication, more often than not, it has brought about effective interventions or effective outcomes. There have been so many research done on how effective these medication treatment programs have worked. And while they've been evidence-based programs, the how it's administered, it depends on the skill set of the clinician or the therapist. It depends on the individual needs of each client. And I think part of the whole research has thrown emphasis on the importance of the relationship between the counselor or the psychotherapist and the client that is in need of that care. I did find most of your arguments very interesting, slightly different from what I was leaning towards, because, in my opinion, more often than not, medication assisted therapy has been more effective because there's been a drop in the numbers of opioid cases, death by opioid or by substance abuse. So if you, for example, you've had someone that has lost a loved one to either drug abuse or to substance abuse or process abuse, more often than not, they will lean towards having a medication that helps them take the edge off these addictions. So I had your reading your paper was interesting, but I still stand. I lean towards the fact that the medication assisted treatment is more effective even if most of this research done is based on um, outpatient rather than inpatient. But I think that it's does more good than harm. Thank you very much.